Our knowledge and truth for a healthy living is a must. Here are the experts. Here are the facts. Here is what we testify to and speak. This is We Shop Talk. Africa.
Absolutely excited to be here. Super excited. We're back home. We're right at motherland, and we're right at Nanda's Hotel. We're just excited about what is about to happen, to be able to help our people, and more importantly, to also be able to develop capacity at the Robert Emmanuel Teaching Hospital. We're excited because all of this has been put in place again by the Honorable Commissioner for Health, Dr. Tommy Coker and Dr. Patrick Ashe. We thank them for their leadership. We can't wait to go to work. See you soon. This is exciting.
Hi, my name is Dr. John Loyagbo. I'm an orthopedic surgeon, so we're here in Shagam, first day about to start. I have 3 hand cases to go before we do a whole lot of osteotomy cases, so about to start excited. It's a great day. Thank you.
My name is Dr. Taiwo Jose. I'm a gastroenterologist practicing in Atlanta, Georgia. I'm very excited. I really am particularly excited about providing some colon cancer care and awareness, especially screening. Colon cancer right now is the 3rd most common cancer-related, that causes cancer-related death. And so the opportunity to really be able to screen, especially high-risk patients, and hopefully catch them at a very early stage so that they get intervention is something that I'm really excited about.
Hi, my name is Dr. Alan Pickens, thoracic surgeon from Atlanta, Georgia. This is our first day here in Shagamu, Ogun State. We are about to begin some thoracic surgery procedures. We've been collecting equipment that we've been supplied to do some minimally invasive operations here, and we also have plans to do some very complex open operations to remove some illnesses from the chest cavity as well. We're looking forward to working with the great facility and staff that are here in Nigeria, and we're looking forward to great outcomes, first of many to come. Thank you very much.
We know that His Excellency Prince Dapo Abiodun actually made health a major pillar in his Ishaya mantra, particularly the social aspect of it. And this today is a collaboration between the federal, because the FMC is involved, the subnational, and then we have the Global Health Charity and Training Foundation from America and England, who happens to be physicians of various specialty, and the earlier speaker had mentioned the variety of specialties they're going to be dealing with. And surprisingly enough, the traditional ruler and the economic development group of an ethnic group, which is the Remote Development Group, we've now collaborated to actually try and deliver quality, affordable healthcare. It's actually free to the people of Remo and Abeokuta as well.
And look at the operations in here, ladies and gentlemen. This is a big reception hall. Right now, we probably have close to over 500 people here. And we have the others who are waiting to be seen. All of them have been issued numbers by the Ogun State Health Insurance Scheme. They are the ones right here on this table, Ogun State Health Insurance Scheme, registering all of the clients coming in for the Ogun State Health Insurance. Remember, we're covering 500 entities of Ogun State for the whole Ogun State Health Insurance Scheme. After they're done and their cards are issued, we're getting the advanced transfer all on this roll. Blood pressure checks. We have all our nurses who are doing this for us. And we have our lab technicians who get their blood drawn for the point of service care, for their cholesterol, diabetes screening, and also hepatitis screening too, also offering that. Once that is done, they move along. Come along with me. Lots of them are medical officers from Olabisi University Hospital, one of our collaborating partners. They have the consultation. All of the clients right here in front of me are all waiting to be seen by the physicians after they've had all their testing done. The physicians will have consultation, one-on-one consultations with them all across, and then after that, come on over to the pharmacy, and here is the pharmacy section where the medications have been prescribed. All along here, for those who are diagnosed with any new medical condition, high blood pressure, cholesterol, diabetes, they get their prescriptions filled. It's a 2-month free supply provided by the U.S. charity training foundation. And then for those who might then need additional follow-ups, they have to then be seen at the Olabisi University Teaching Hospital. Lastly, we have here today, we actually have 2 cardiologists who are here with us, Dr. David Badibo from Atlanta and Dr. Inofeme, also here from Olabisi University Teaching Hospital. They are consulting with the patients whose blood pressure was unrecordable yesterday. The pressure was over 270 systolic blood pressure. High, that the charts just off the charts. But she came in here today, the pressure's already run a little bit better on the regimen of medication that she was given. This is going to be repeated again tomorrow.
Good day, wherever you join us from around the world. We are coming to you today live from Shagamu, Ogun State, Nigeria. Thanks so much for joining us on We Shop Talk. This is episode 10. We Shop Talk is a conversation that we have relating to health and health-related matters as affects us in our communities. This is a special edition. It's special because we are part of a multidisciplinary medical surgical team that are visiting hospitals in Ogun State, the Federal Medical Center in Abeokuta, the Olabisi University Teaching Hospital in Shagamu, the Ijebu-Ode State Hospital, where we've been involved with activities in surgery, various surgical procedures, and medical outreaches over the last 1 year. This episode is going to capture the essence of the surgical procedures that we've had. We've also had a gastroenterology team that was with us, led by Dr. Taiwo Joseph this week, and also to be able to learn some of the lessons from this first of its kind, the inaugural medical surgical mission trip that was put together by the Foundation, Global Health Charity and Training Foundation based out of the United States. This foundation also had members from Nigeria and also from the United Kingdom. So let's start with Dr. John Misugo, the orthopedic surgeon. What attracted you, Dr. John, to this medical job?
For me, I would say one, the privilege, opportunity to give back to this environment and society where I grew up now. Just so many patients, so many people out there who don't have quality health care, especially when it comes to orthopedic surgery. You know, people walk around with just really terrible deformities and maladaptive, gaits and stuff like that. And you see these patients and you wonder if just a little bit of a time we can add something to their lives to completely change their lives. And some of these patients are so poor and they cannot afford, the most basic of healthcare. And imagine walking on your hands, like an animal all your life. When a simple procedure can make a difference, and just because you can afford it, it becomes very difficult. And that's one of the things that just kind of spurred me when I was approached to come on this.
It's Olabisi Banjo University Teaching Hospital. You can see around us. We're just coming from the pediatric ward. We're just getting ready to clock to Remo Community Center now for the community outreach. This is day 2. I'm excited about this. And the surgeons are already going to be in the OR this morning, getting things done. We'll see you soon.
How old are you, ma'am? Testing. The 50-year-old female with a very bad virus deformity. And because it's such an old deformity, she has what we call leg length discrepancy. See how short this leg is? It's short now, and she has a very severe instability at the joint line, right there. So our goal is to try and correct this deformity the best we can, and then get her to straight enough to be able to walk it, make that all straight. And that's I did my job, my partner, in kind here. So I think, right, my big buddy, they've been taking care of this place for a very long time. And our residents, 2 residents, that's all those things. And let's take care of them out do this job, they're doing sort of set the super job. You can saw the faces here, right? Super. Thank you.
Thank you so much, Dr. John Percival. And to you, same question, Dr. Alan Pickens. What was the attraction to come on this medical or surgical medical center? So, Dr. Pickens.
For me, it was also the opportunity to give back in a way that was meaningful. It provided not only clinical care to the citizens of Nigeria in this region, but also education for the physicians that are currently here. We provided opportunities for them to see some different approaches to cardiothoracic surgery that perhaps they can use to better care for patients in the future. In addition to the medical care that we provided, there was also extension of continuity of care. The physicians locally that we collaborated with are present to help take care of these patients long after we have left the premises. There was also the opportunity for them to have medical insurance applied to their care so that they could get doctor's visits after we left, as well as medications after we left. So all of those things together made it the perfect opportunity to come back and give back in a meaningful way that was sustainable. Those are the things that made me want to be a part of the team. So thank you for the opportunity.
It's day 2 of this mission trip. It's Monday. We're heading out to the hospital, Olabisi University Teaching Hospital. Well, some surgeries will be conducted: orthopedic surgery, general surgery, urologic surgery, and we also have some obstetric case reviews. Bigger piece too, we're going to be out in the community this morning too, where we're going to screen about 500 indigenous of Ogun State here in Remo land. I'm also going to be doing some colonoscopies too in the hospital. We're really excited. Let's get the job done.
Thank you so much, Dr. Pickens. And same question to you, Dr. Taiwo Joseph, as the lead of the gastroenterology team. What attracted Dr. Joseph?
Yeah, I think similar to Dr. Pickens and Dr. John, it's just the opportunity and joy to be able to add value to lives. I think that basic healthcare is a basic need for any community. And I think the African community, the Middle of the states are worthy of being just really good healthcare, just like anywhere in the world. And so when I found out about this opportunity, I was beyond science to really come on board and be able to do my part for the quality.
Thank you so much, Dr. Joseph. And before we talk about some of the cases that you saw, you do this every day, all 3 of you in Atlanta. To you, Dr. Pickens, how has this been different from your day-to-day activities in your OR and your surgical team? How has it been different?
So I think learning to operate in environments that are not as you are accustomed to is a learning experience for me as a surgeon. Learning that you can do a lot with minimal supply. You don't have to have all the luxuries just to get operations done. And it makes it much more affordable for patients when we can do these types of operations with less. For me, also, it was educational in the sense that we don't see a lot of advanced lung destruction from TB, which is one of the cases that we did here locally. Those are great opportunities for us to learn about the complex infection and adhesions and scarring that we don't often see in the States. But we had an opportunity to do one of those cases successfully and take out a portion of the lung that was creating some infection problems for a young lady and led her to have massive bleeding from her lung. Those are things that we don't often see in the States. And so for me, that was a learning opportunity. We also had the opportunity to do a case that was a later diagnosed patent ductus arteriosus, or an open blood vessel between the pulmonary artery and the aorta in a child that was 11 years old. Most of those cases present when children are much younger and get repaired in the States when they are much younger. This child was 11 and had her diagnosis made. We were able to ligate that blood vessel and hopefully prevent her from having severe heart failure in the future. So those are things that we don't often see in the States. The approaches that we provided for doing them here in Africa perhaps will allow the local surgeons to be able to do them in a different approach.
And to you, Dr. Obo, kind of different spin on that same question. How did you prepare? What was the preparation to make this trip? Were you able to connect with physicians on the ground? How long was the preparation? And how prepared were you coming through? Do you think the preparation was adequate?
Yeah, I'd say a really complex question because you can never prepare for what I saw on the ground. Absolutely can never prepare. But to some extent, the physicians on the ground here and the hospital itself were really, they supported us in just ways that I never believed they would support us, I literally talked to the attendant surgeon on a daily basis for the past 2 or 3 months to to screen patients, to select patients, so that we make sure, number one, that they're indigent patients, which is the primary focus. Patients can afford care. Number two, to make sure that they had at least the basic things like something to stop bleeding, to reduce complications for staff, and all the basic things we need for surgery, and just to make sure they had all that stuff. And then the third thing was I got a lot of support from companies that without their support, I don't think this would have been successful. Stryker Orthopedics really came on board to help us. Atrix Orthopedics came on board to help us, and then most of all, the MedShare in Atlanta gave us a lot of equipment, which fortunately, for this hospital here, some of the stuff they've never seen in their lives. We walked into the operating room with this equipment, and the whole hospital, the news went around, and they were just coming, and I had to teach, for sustainability, to teach how to use a lot of this equipment. And it made a world of difference to these companies. And then number four, like I said, there's nothing that prepares you to see what we saw on the ground. Some of the deformities I saw and I had to take care of, never seen in my life, perhaps. And just basic principles still help me, to use the minimal resources that they had on the ground. I had a kid who had bilateral roadside deformities, almost 90-degree curves on both knees, and the arms were almost touching the ground, which walls, and we're able to straighten both knees out. We were straightening both teeth, the multi-planar deformities. And I had another kid I had patients who had multiple deformities that we had to correct. But I had another kid who had what are called a neglected club for deformity. His kid was basically walking on the side of a foot, literally all his life. He's 14 years old, and his other leg was 4 inches short. And we were able to twist and twist and twist and the mom to correct that foot. And I noticed the mother was literally crying. She passed out initially. One would say, "Hey, we're not going to do the surgery," but that was just a life-changing experience for me. And even in a crude environment, we did the first total hip replacement in this hospital, and also total knee replacements. You know, a very difficult environment, we were able to do that. That shows that we can actually do that with adaptation. And you don't need an expensive place. We've got a lot of support. We've got places, schools to help. But there's so much I taught them to do with just what are called K-wires or standard plates. You can twist the bones around and use this very basic cheap thing to correct deformities. And they learned kids, the residents were so grateful. And we plan to continue to collaborate, perhaps have teaching sessions virtually on a monthly basis. I give them articles to read, and they will do a virtual teaching, but just to help sustain what we presented here.
Thank you so much, Dr. John Lewis.
One of the board of trustees of the Global Health Charity and Training Foundation. It's an exciting day here in Remo land. We're here at the Remo Community Center in Peru, where we are running a community health screening for 500 indigents of Remo land and obviously of Ogun State. We're running blood pressure checks, we're running cholesterol checks, we're running diabetes testing, alongside with prostate cancer and colon cancer screening. But guess this is the biggest part. 500 of these ladies and gentlemen who are coming here today, indigents of Ogun State, are also getting their Ogun State health insurance card scheme that will keep them insured for the next 1 year. Our plan is to make sure that they're fully enrolled in the Ogun State Health Insurance Scheme and be able to follow through on whatever diagnosis they are picked up today. And for those who are unfortunate to have a newly diagnosed condition like high blood pressure or diabetes or cholesterol, today they're also going to go home with 2 months free prescription of their medications, and then they'll follow up with their physician over the next 2 months. This is an exciting day, and as we speak, we also have all our surgeons at the Olabisi Onabanjo University Teaching Hospital who are conducting surgeries today. We have 8 orthopedic surgeries being conducted. We have 8 general surgeries, 8 urologic surgeries that are being conducted, and we're also going to run 10 colonoscopies for colon cancer screening. Global Health Charity and Training Foundation, working of course in collaboration with the Olabisi Onabanjo University Teaching Hospital, and we're ever thankful to the Honorable Commissioner for Health, Dr. Tomi Koka, who has made this possible, alongside with the Chief Medical Director, Dr. Fatu Jache, and all of our other collaborators, including the Remond Development Group. We sincerely appreciate everybody's partnership, and we look forward to continue to work with all of these groups and bringing health, making it affordable to all of the citizens of the state. Thank you very much.
Thank you.
Now we're going to talk a little bit more about 1 or 2 cases that stand out to all of you in terms of what you saw. Olabisi Onabanjo University Teaching Hospital, to our viewers, is a 400-bed teaching hospital, the only public teaching hospital in Ogun State, a state of over 6 million indigents. There is a private institution too that's a teaching hospital. But to hear that during this medical mission trip, we had the first hip replacement surgery is absolutely gratifying, Dr. John Lewis. And along those lines, to you, Dr. Taiwo Jose, you also had a team, local team that you worked with. Can you take us from day 1 to day 2 to day 3 in terms of the adaptations and how you were able to get things done, knowing that you could not scope on day 1? What was that all about?
Yeah, I think so we obviously have been preparing prior to the trip. I do not believe that they had a colonoscope here at Olabisi Onabanjo Teaching Hospital. And so prior to getting here, we've been trying to secure a colonoscope for our screening procedures and also diagnostic and therapeutic procedures. We were able to secure a colonoscope eventually, thanks to the Ogun State government. But upon arrival on the first day, we realized that the colonoscope was broken, and we unfortunately could not use it. And so we had to improvise with the upper endoscope to do a few procedures with some of the patients who were already with us. We reached out to the CMD, the Commission on Health, and they were able to reach out to the folks who helped us secure the scope. And by the end of the second day, we were able to get a new colonoscope to help us with our proceedings. I think something that stood out to me, just similar to Dr. Dickens and Dr. John, is just how you would really just have to adapt when you get to an environment where the resources are very limited. I remember when I was first handed the colonoscope, the first thing I asked was, "Where's the water jet? How am I going to do my procedure without a water jet?" There was no water jet, but I was able to do my procedure with a flush. The nurse who was assisting me had to flush every time I needed to clean during my procedure. And while I was doing the procedure, I was just very stunned at how I could complete the procedure without a water jet, which is what I'm used to in the way of practice. So I'm glad that even though the first day we were not able to complete a lot of procedures because the colonoscope was broken, by the third day we were able to make up for the first 2 days by doing so many procedures, and I'm glad that we were still able to offer care to as many patients as we could.
And Dr. Joseph is saying we're able to do more on the third day. She did 16 scope procedures, gastroscope and endoscope, in almost probably like a 6-hour time frame, almost unheard of. And to be able to accomplish that and accomplish it successfully also stays to the power of being able to adapt to your environment. But prior to that, the day on Monday and Tuesday were not wasted days, right? Dr. Joseph, what happened on those days?
On those days, I had the privilege, and I think for me, it's probably the highlight of one of the highlights. I have many highlights of this program for me. I had the privilege of spending time with the medical students. They were very excited. We had a lot of learning sessions. You could tell that they haven't, in a while, had that much education as it pertains to GI. They had a lot of questions. I saw the light in their faces just while I was spending time with them. So that was really great. And we were also able to see several patients in clinic, and we were able to see a few patients on the wards as well. And on those days, we were able to do some procedures, we were able to do some upper endoscopes, and we were able to convert some of the colonoscopies into flexible sigmoidoscopies, which is just looking at about a third of the colon with the upper endoscope.
The other part too that Dr. Joseph has not mentioned is the fact that the tower that was used for the scopes was brought in from a different hospital, and the colonoscope came from a merchant, and they were able to still match both to make it work. Yes, the first 2 days were not wasted because the name of this organization, again, for our viewers, is Global Health Charity and Training Foundation. There's a charity component and then there's a training component. Training component and charity components both go together to help us accomplish our mission. And to also our viewers, and this was a multidisciplinary collaboration. But we had collaborations with the Eniola Cancer Care Foundation, the Paramedical Center in Abeokuta, and also the Lawrence Obanjo University Teaching Hospital, with tons of volunteers.
Some schemes where you pay a percentage of the total cost, but for our percentage insurance, it is zero co-payment. They are not, let me repeat, they are not expected to pay anything as long as it is covered on the benefit plan.
It's day 3, ladies and gentlemen. It's an exciting day. We're here at the community health screening event at the Akintobi Palace in Shagamu, here in Ogun State, Nigeria. Take a look at behind me. These are folks who are waiting to be seen here today. We have over 1,000, do you hear me? 1,000 clients waiting to be seen. We're checking blood pressures or the vital signs, we're checking the cholesterol, we're checking screening for diabetes, alongside with colon and prostate cancer screening. This is absolutely exciting. Come on in.
Huge need to enroll people in healthcare insurance. The need is great, and it is very rewarding to be able to help with enrolling and taking care of these patients. Even though I'm a rheumatologist, I'm just freelancing today, helping out wherever is needed.
To you, Dr. Pickens, what was your team like? Because I understand too that you had some residents that came from a sister teaching hospital, knowing that Olabisi University Teaching Hospital does not have a cardiothoracic surgery unit. And Dr. Pickens had to travel an hour to get to Abeokuta from Shagamu to be able to operate at a hospital that has a cardiothoracic surgery. But having a team of doctors from Federal Medical Center Abeokuta, from University College Hospital in Ibadan, and yourself and some team of residents, what was that like? What was that team like? And what was the cohesion? And if you can take us through the fact that you had to go there again.
So, as you mentioned, in preparation for this trip and doing open chest procedures, we had long discussions about the resources available at the Ogun State Hospital compared to the federal hospital. And the federal hospital had previous cardiothoracic surgery procedures done on site. So we spoke with cardiothoracic surgeons at that location that had done operations in the chest previously. So we felt it was safer for me to travel to the patients in that region as opposed to staying here locally and trying to do an operation that had not been done. Perhaps we would have been able to do it in the operating room, but it's not just what happens in the OR, it's what is done after the operation as well, the care of the patient. So they had very well organized intensive care unit spaces, opportunities for monitoring, opportunities for chest tube management, as well as skilled nursing that knew how to take care of the patients following open chest operations. So we were able to go there on the day before we did the operations, meet the patients. I met their families and talked to them about the operations that we were planning to do and described it as well as we could with interpretation.
How was that?
It was good. I gave my English version, and then someone gave a interpretation in the native language, and that was the great part of having the cardiothoracic surgeons locally present, because they understood concepts that we were describing, and they were able to give them a very good description of what we were planning to do. And so they were very well informed prior to the operation, both the patients and the families. From there, we were able to then go over on the day of surgery, arrived. We had residents present. There were 4 residents, cardiothoracic residents present we had a teaching session prior to the procedures where we sat in the conference room and we went through all the details of what we were planning to do. We talked about the physiology, we talked about the disease process, and then they were able to actually come into the operating room and see the operations done. We were able to use some advanced, minimally invasive techniques to approach some of these procedures to give them insight into how to do that, minimally invasive in the future. And then we did some open procedures as well.
Thank you so much, Dr. Pickens. And to our viewers, what we have on is the local attire called the Adire, which is indigenous to Ogun State. We are excited to be here and to imbibe the culture. Dr. Joseph went to college here in this city at the Federal Government Girls College, Shagamu. And when the residents heard that she was a graduate of this institution, their excitement level with us went up. To you, Dr. John Risubu, who operated every day here from 8 a.m. to 11 p.m. 8 a.m. to 11 p.m. on 4 consecutive days, Monday, Tuesday, Wednesday, Thursday, with a team of residents, a team of medical students, a team of surgeons who had never seen the kind of surgeries that Dr. John Risubu was performing, and the way he was changing lives with grace with all of them. Where did you find the energy? Dr.
And energy, I don't know. I thank God. Above all things, God's mercy and God's grace. That's what I'll say. Me. The excitement, the fact that I had a privilege of changing someone's life, just getting it going. You need to see the smiles. You need to see the gratitude from those people. You need to absolutely just see, how someone who people say, hey, this person may never walk again, like one of the kids, was so depressed, just seeing her for the first time. But the joy after the surgery, see, was powerful, was absolutely powerful. Not just the joy from the parent, but the joy in facing the kid. So, I mean, for me, that was what kept me going. The entire operating room day, we gather around, just trying to peep in the room and see what we were doing, see what was happening. And at times, just seeing someone, instant results, seeing a deformity, the next minute you see things corrected, was really for some people was just really excited, and they were clapping and excited, and everyone was involved. For me, that's how I would say. The residents, the doctors, the nurses, the staff, they were involved in this whole process, and they were happy. For me, that's enough to keep me going. I would. I didn't want any patient to go back to home and say, "Hey, I've been waiting all day for the surgery. Let's get going." If they keep going, if they have an open room for us to keep going, no problem.
Can you take us through probably your most challenging case?
Yeah, I would say the kid with the neglected club for deformity. That was the first time I did one like that. I take care of really bad deformities before, with so much equipment around. In this case, all I had was a knife, and with a few K, what about KYs, and it was a slow process, and slowly was able to correct that foot. It took a minute, to do it, and I was so glad that I was able to do it. That's for me. That's the most fulfilling case, But there was only that. I mean, there's so many. There's so many that had to do things that I had to adapt to do things I'd never done before. Describe literature for years, but with each motion, and you change. This kind of changed.
Dr. John. Dr. Joseph, you do this again?
Oh, absolutely. I would love to see chance to do this again. Just seeing the faces and the joy on the faces of the people, especially here in the assisted procedures, just seeing the joy on the faces of people saying, "Hey, I wouldn't have been able to afford this otherwise when they're putting the money to do this." There's a lot that keep me coming back here every month.
And let's also say this to our audience. A collaborative effort like this requires the private sector, the public sector, and for all of us to come together to create some synergy. When we came, we were received by the Royal Highness, the paramount ruler of Remoland, the Akari. So having the traditional rulers involved and the Remo Development and Growth Foundation also involved was just very refreshing. And it would be remiss not to give credit to the Chief Medical Director, Dr. Fatu Gashi, who, through her leadership, her dogged leadership and dedication, was able to open her door, open her hearts to us, and they welcomed us like we never expected. It exceeded our expectations. To you, Dr. John Rusuba, so look forward. I know you had mentioned about some future collaborations that you see with ambulatory specialists from the United States, knowing the need. How do you see that playing out?
Yeah, I mean, we started the contacts already with the American Orthopedic Society, humanitarian group, diplomacy, and we started communicating with the local staff on the ground. We just see how things go. We tentatively looking at January next year to visit OETH and hopefully see what happens. Go back, join them at that time too. And just listening.
Wonderful. And as we kind of wrap up this segment, we'll have a second segment now with the medical team and also the team that was involved in the community health outreaches. Dr. Pickens had mentioned the issue of the insurance. We in our foundation have actually covered 2,000 indigents of the state for the state health insurance scheme. And for those who also had the surgery, they will also be covered. The importance of that, of course, is continuity to be sure that they can have a primary healthcare service, they can get a secondary healthcare service, they can have tertiary in teaching hospitals. What would you like our audience to know? All three, same question. Dr. Pickens, Dr. John Risco, and Dr. Joseph Rappo. Let's start with Dr. Pickens.
We just like to emphasize to the audience the importance of giving back. The opportunity doesn't require a lot. It just requires a little bit of your time, a little bit of passion, and compassion for your fellow man. There are many organizations such as ours that provide services, but I think ours is uniquely qualified to provide multidisciplinary approach that allows you to touch more people in an efficient fashion.
Thank you so much, Dr. Pickens. To Dr. John Wilson.
I completely agree with what you say, just join us, help us take care of a lot of people. You were surprised at the difference you're going to make in just one family at a time, one individual at a time, one community at a time. Please join us and help us. Listen here.
Dr. Joseph.
As I mentioned earlier, I believe that good healthcare is a basic need of any society, and the African society is not excluded. I think, we are all, not that I think, I know that we are all worthy of healthcare. And so we're asking that you collaborate with us. There's just so much work that needs to be done. And if this resonates with me anyway, please collaborate with our team to provide good healthcare to more and more African communities in the future.
Thank you so much, our surgeons. Outstanding, absolutely outstanding.
Day 4 is a wrap, and that's day 3 of our community outreach. We're here at the Akairos Palace in Shagamu, and believe it or not, we've just concluded seeing over 600 patients here this afternoon. It's all clean now. We had over 80 volunteers that included nursing students, nurses. We had medical labs scientists that helped us out. We had some medical officers, about 6 of them. And we had the pharmacy section. It was a fantastic flow, much better flow than it was yesterday, with a lot of 550 who got their health insurance, Ogun State health insurance policy that will obviously give them insurance coverage for a whole year. For those who are newly diagnosed with certain medical conditions, they also got their prescriptions today. We had individuals that had their blood pressure that was unrecordable, over 300 millimeters of mercury for their systolic blood pressure. And that is the kind of scenario that we had today. We had someone that had a high blood sugar of over close to 600 here today, non-diabetic. And the beauty of all of this is that despite the treatment that they're going to get today, they also will now be plugged into the Ogun State Health Insurance Health Scheme. As we speak, the surgeons are still operating. Dr. John Louis Ugbo, who leads our orthopedic unit, has been in the theater from about 8 o'clock every day to 11 p.m., teaching medical students and also delivering quality service. Dr. Sikiru Adebayo leads our urology team. He's also been in the OR. He had 2 uroplastic surgeries yesterday, and he has 1 prostatectomy scheduled for today. Dr. Shina Faole, heading our general surgery unit, has had some hernia repairs. He has 2 gallbladder surgeries today that is also operating. And we also have the pediatric surgeon in Dr. Mundele, who has been working with this team feverishly. It's been a fantastic day 4. In addition to that, Dr. Laurie of the obstetrics unit has actually been, is now currently as we speak in Ijebu Ode. Ijebu Ode North local government area has the highest maternal mortality in the state, and is also been accompanied there today by the Honorable Commissioner for Dr. Mikoka to do some OB case reviews to find ways to definitely be able to increase the quality of care that is delivered. This has been a fantastic experience. We wrap up here in Remo land after 3 days of outstanding service given to the Remo people. We again want to appreciate all our collaborators, including the matron who has been here with us, leading the charge of all the nurses. As we head to Abeokuta tomorrow, we're going to wrap up the community outreach at the Lakes Palace in Abeokuta. We're of course expecting a huge turnout in Motherland in Abeokuta. We're expecting probably 1,000 folks that are going to be servicing. Remember, these services will include blood pressure checks, diabetes check, cholesterol check. We're also checking for prostate cancer with the fecal local blood testing that will be done there, and the rapid testing that was done for prostate cancer for men. It promises to be great. As we head to Abeokuta tomorrow with some of our team members here that will be led by the matron, we will have up to about 20 that will be traveling with us from Shagamu to Abeokuta. And we're hoping, now we know for sure that we're going to wrap up the day with a courtesy call to the Lake of Abeokuta of Agbadebo. We're looking forward to doing that on Thursday, and Friday will be a day of site visits to Abeokuta. It's been a wonderful day. Thanks to all our volunteers, about 80 of them that we had today. Again, it's been a fantastic day 4. We look forward to day 5. See you soon.
Now that you heard the facts, apply the knowledge. Contact your doctor or healthcare specialist. Scan the QR code to provide more information on today's talk. See you on the next. We Shop Talk, Africa.